welcome back. Today I am joined by Dr. Christine Chung from 7-Day Dental. Well, welcome. Thank you for joining me.
Oh, thank you for having me. I'm so excited to be back.
I know it's been a while. So welcome back, even though it's, in our wild Zoom setting these days. But nonetheless, let's talk about 7-Day Dental and what are some of the things. I know you guys were closed for a while and now you have reopened. What are some of the things you'd like to tell the residents about your facility?
Thank you, Lisa. So first off, I want to make sure that patients feel comfortable and safe. Our number one priority is for the patient's health and safety, and also for our staff, that when they come in and work, they are in a safety environment. So we taking all kinds of measures, protocols, and follow the guidelines of CDC and WHO and also OSHA. So the steps that we're taking is that we screen all the patients. We have the questionnaires, the COVID-19 questionnaires. We take temperature for every patient. And the questionnaires are very simple. I mean, you get that everywhere you go. And prior to treatment, we also have patient goggle with hydrogen peroxide to minimize the bacterial in the mouth before we even start.
Okay.
In our office, we have the sneeze guard. We also ask the patients to come in covered with masks and still practice social distancing. With that saying, we have limit the number of patients per hour that we do see. We have to stagger our appointments. And for every patient who leaves the office, we break down the room and we disinfect the entire office before seeing another patient. So, I mean, it's time consuming, but whatever that we do, we want to make sure that it's follow all the guidelines. And like I said, we want the patient to feel safe when come back to our office, and we are fully back and fully operated. Mm-hmm.
Right, so
Not only that, we also take extra steps. We use the air purifier all over the office with ultraviolet lights to kill the bacteria. And many patients who's coming for a routine cleaning, we also utilize or use laser prior to that, because laser is it's non-invasive, and that can kill the bacteria prior to using a cavitron machine. So less bacteria in the aerosol and in the air, producing a safety environment for all of us working in the office, patients and the staff.
Okay, well, that's interesting to know because I had not heard about the laser treatment. How is that used?
So we have been using laser for a number of patients who has periodontal disease, but now we have implemented almost every patient, and it's called laser bacterial reduction. So there's no pain. We don't have to numb the patient. It's very minimal invasive. We use the laser at a small setting, so it's pain-free. Mm-hmm. And it takes about 10 minutes prior to using our scalers or the cavitron machine. When we have that water aerosol, there's 0 to none bacteria in the aerosol. Okay. So the helps of the laser bring down the bacteria count. So I wanted the patient to understand that it's really safe.
Right. That's awesome. That's really a good thing to do. And you've done all the protocols as you've mentioned, and it sounds great. Now, one thing I think for those people who have not kept their appointments, I mean, people were afraid. What are some things, like, just in case they are still afraid? And I know that, you're telling them everything that they need to be doing and what you've been doing, but maybe they're still a little nervous. What can they do before they come to you to help their teeth stay better?
Well, I can try to do teledentistry if they are afraid. If they want to do consultation over the phone, we can do that. But I still encourage to keep their appointment for their routine cleaning. Like I mentioned just now, when we do cleaning, it's very safe. We use all kinds of safety measurements, and we disinfect. We also use to defog the entire office every night, each and every night. So our environment, the air is not polluted. And if there's no elective per se veneers or any type of cosmetic dentistry, maybe you can hold off. But I still think that keeping your appointment on a regular basis for your regular cleaning routine, checkup and cleaning is still very important, and it's crucial.
Okay, excellent. Well, I mean, you guys have done everything you need to do, and I'm glad we're able to tell the residents that it's safe to go back and have their regular checkups. So thank you.
Yes, please do come and visit us. The office has changed a little bit ever since we reopened. There's no waiting room, so when they come in, they can check in. We do some of the prior screening, temperature check, and we want to make sure our room is ready for them prior for them to come in. But if needs to, they just have to be waited in the car, but not in the waiting room. So there's we are practicing social distancing, and there's no direct contact with other patients or any other staff that, we minimizing that.
Right.
And keeping social distancing every single time.
All right. Excellent. Well, wonderful.
Well, we want to invite the patient to come back and check us out.
I think they will, now that they know that you've done all that great stuff. So I appreciate it. So thank you so much. And hopefully we'll have you in the studio soon.
Thank you so much, Lisa. It's good talking to you. And we welcome all the patients. If you need anything, please call us. We are available. Even if we're not in the office, I always on call, and I can always call them back and guide them over the phone or do any kind of consultation. We are open 24 hours if needs to. And we have another office in Anaheim that we're open 7 days a week. And if anything, we'll be there. We're there for you, and we'll take care of any emergency or non-emergency needs to all patients.
All right. Very good. Thank you.
Thank you, Lisa. You have a
All
great
right.
day. Bye-bye now.
And we'll be right back after this.